So welcome to week 2. I mean, week 1's gone. You've had your first quiz. I am willing to go over that quiz with anybody who wants to. I'm available Monday. Let me know, and we could start there. Next week starts your reviews for exam 1 already. I am doing the one on Wednesday for y'all at 4 o'clock. Now, I do record all the reviews, so do all the other professors. And the way I post it is in one recording. It will say exam 1 review recordings, and I will edit it and add the new recording for each professor, unless you want 7 announcements. And I don't think you want to go looking, searching, hunting, pecking. No, I think most of you have 3 courses. You don't have time to do that. So I put it in one place for you. If you notice, I put all the Kahoots there for you. Week 3 might change a little bit because I'm still working on it. I'm still reviewing it. But if it does, you're still going to get it on week 3. And I'll change it in that post so that it will change. And I'll be doing that over the weekend. This week's just been very, very busy. So, but I will make sure that it's done and you'll have that updated concepts that I know that are going to be sitting on quizzes and exams. It's going to be those Kahoots and those exams. Okay, so I will have that ready for you. This week, we're going to be going over infants, toddlers, preschoolers. Now, as I said earlier, your exam is heavy hitting on infants. But think about, why is it heavy hitting? Well, what happens in the first year of life? A lot. You go from a 7-pound infant who can't lift their head to a 1-year-old who's triple that birth weight, 21 pounds or thereabouts, and they're walking and talking. So that's the growth and development they're looking at: fine motor skills, gross motor skills, and all of those things that newborn infants can get, things to look out for. So I've infused and updated PowerPoints, and I've updated your Kahoots this quarter to try to give you even more information that you do need. Any questions about anything so far? Have you run into any problems at all? You're able to get all of the information, because I ended up resending it in a Canvas text message, so that to make sure that you got all the handouts, etc. Okay. Remember, if you don't get it, send me a message and I will send it to you. I'll be sure. Actually, what you do is you alert me and I send it out to everybody just to be sure. One person don't get it, maybe you all don't. So I do that for you. So week 2, I think it's a fun week. I think it's a lot of interesting things. I mean, who doesn't like a baby and young little kids, right? And everything that they do. So as I said, first year, it's the most fast-moving, dramatic type of movement that you will see in any human being. This is that 1 year where initially they're born, they lose 10% of their body weight, and then they start gaining 5 to 7 ounces per week. They'll double their birth weight by 6 months. They'll triple it by 1 year. And also, they're growing 1 inch a month for the first 6 months. So they're really, really growing a lot. Now at birth, you've seen the vital sign sheet. And those neonates, their respiratory and heart rate are 140 to 60 and 40 to 60 respiratory rate. As you get older, those numbers come down. Now, blood pressure. What is a normal newborn's blood pressure? That number, like adults, is 120 over 80. It's 60 over 40. So that number goes up. Heart rate, respiratory rate go down, blood pressure goes up. Now, we know at birth, the baby's given mom's immune system, given her blood cells, the iron, given everything. But we know blood cells die. So eventually the baby's going to have to start making their own immune systems and their own blood cells, and need to get iron from somewhere, right? So usually babies don't start making their own cells till right around 6 months. So it's not uncommon to see very low hemoglobin hematocrits at 6 months. 9 and 27, 10 and 30 are not uncommon at all. But as long as they're happy, healthy, asymptomatic, it's not a big problem, okay? And we expect it. Now, at birth, heads are huge. You've learned that in your OB class. Now, when they're growing, that head starts to stay the same, but their body gets bigger. And now that chest that was smaller than the head, right around 12 to 15, 18 months, it will equal, and then the head is actually smaller then. So again, that's one of those developmental things we'll look at. The head's still bigger than the chest at 2 years, there's a problem. And what does that mean? Further investigation. Why is that? We have two fontanelles. We have the posterior that's in the back that closes really quick. Within 2 months, it's gone. Now, the one up top, that soft spot, fontanelle anterior, is usually closed around 12 to 18 months. And the average, yes, about 14, 15 months it closes. Now, we do check those and we see if they are closing. If they close too quick, the brain can't grow. If it doesn't close quick enough, why? Is there extra fluid? Is there a tumor? I don't know. It's something that, again, needs investigated. When babies are born, they can hear and they can see, but they see through each eye separately. They don't work together. And it's called binocularity. And what happens when both eyes don't work together? There's no depth perception. And usually about 9 months is when they start to be able to grab, which is interesting in their eyesight. As I said, immune system, children are born with mommies. They're also born with things like the vernix and all of that. It's all protective devices that helps protect them. We know that we're given a lot of immunizations really quick. What's the first one? Hepatitis B, usually at the hospital. Sometimes it's at that 2-week checkup. And a lot of times, believe it or not, that's because of insurance, believe it. Insurance does sometimes, and if y'all working with the medical system, know that insurance sometimes dictates when and how you can get tests done or medications given. And that's just, what the system is. But it is given, first one. Then we're given 2, 4, 6 months, a whole load of them. But why are we doing that so much so quick? Well, by 6 months, mommy's immune system is really wearing off unless they're breastfed. And then we know breastfed babies are constantly getting that immune system given to them. Mommy gets sick, she's making all of those antigens and immunoglobulins to try to help infections. She gives it to the baby so the baby doesn't get sick, right? Now, at birth, a baby is born. It's in that nice, warm, wet place, comes out, and now they're in a cold room and they're wet. So, what do we do at first? Well, thermal regulation. They can't tolerate being out in the environment, especially wet. So, we're going to dry them off really quick and put them underneath a warmer. You know what happens if a baby becomes hypothermic? Their heart rates drop. I've actually seen this where being a newborn ICU nurse at some points in my life, where the nurse forgets to turn the warmer on after a bath or changing the bed. And all of a sudden the heart rate's going down. And I look up, the warmer's off. So I've seen it. I know it happens. And we know we want that heart rate beating the way it should, getting, all of those oxygen and iron to where the body needs it. Now, at birth, they have all this extracellular fluid because they're floating in fluids, and then immediately they're going to lose it, right? That's all that 10% of body weight that comes off. So after that, babies start getting that adipose tissue, and now they're going to be easier to maintain their own temperatures. But at birth is the one that we have to watch the most. So prehension, how they grasp things. Now, there is fine motor skills, and F is fingers, all right? There's gross motor skills, fine motor skills. F is fingers, okay? F, fine fingers. And it has to do with initially, mom puts her hand into the warmer, and that little baby puts their little hand and grasps it. And it is one of those involuntary reflex type of grasp. Eventually, it becomes, and it's called a palmar, a reflex palmar, because it's the palm of the hand. Now, that's the initial fine motor skill. Well, then it becomes voluntary. They could do it by themselves. And then about 8, 9 months, they start out sitting up unsupported. So that's when you put them in the high chair. And that's when you start giving them food, right? And I know many of us put those little puffy snacks or Cheerios or whatever, and they take their hands and smoosh it in their face. Well, that's called a crude pincer grasp. And then all of a sudden they take it one finger and a thumb, forefinger, thumb, and that's a fine pincer grasp. And that's about up to 10 months. And that continues. Now, at 11 months, they should be able to take things out of containers. Before that, they didn't understand that they could come out. They would just see them in there and not understand. At 11 months, they pull it out. And then by 1, they can build a block of 2. And that's just a quick quiz for you. Now, gross motor is G, get up and go, 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 like Paw Patrol, as I call it. And that's movement. Well, what's the first movement ahead that a child does? And that's picking their head up. And that should be accomplished by 3 months. Now, turning over. Now, my grandson at 2 weeks was turning from his belly to his back. I think it was an accident, but it happened. But according to the book, 5 months from their belly, they can turn over to their back. By 6 months, from their backs over to their belly. Why is that important? Well, now they can roll off of things. Now it's safety. They're going to roll off of couches. They're going to roll off of beds, changing tables, and we need to teach our parents that. Sitting unsupported 8 months is whereabout they should. About 10 months, they go from their backs prone, and now they can sit up by themselves. So there are certain gross motor skills that they'll do. And it's things that we look at, because if they're not doing the skill they're supposed to, we got to figure out why. Is it nutrition? Because remember, nutrition is all about cognitive stuff. Here, Brian. So if it's not nutrition, maybe it's some cognitive problem. Maybe there's a delay, there's a hypoxic episode, something happened, right? So we're going to be looking at it. Now, if they're not sitting up by 8 months, but they're already standing up and creeping, we know we're okay because they're forward in their development. But if they're not doing any of that, they're not rolling over by 8, 9 months, we're going to put in early intervention. As they get older, it'd be speech therapy, younger kids, physical or occupational therapy to teach them how to do these things. And what's so great about kids and children and babies, they catch up really, really quick. You've just got to get early intervention. So gross motor is, get up and go, 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 right? So cephalocaudal is a development. Starts with their head movement, and then it ends in they're up on their feet, which is the caudal, and walking. That's what that means. They're crawling after they're rolling front to back, back to front. Now they're up on their knees. They usually crawl backwards first, don't they? And then they start crawling forward. Creeping, they're up, pulled on the side of a couch, and up, standing up, and walking, holding on to things. That's what that means. And then at 11 months, you can hold their hands and they're going to walk or hold a hand. They should be attempting to walk alone at 1 year. It doesn't mean all babies are walking at 1 year. They could be walking at 9 months. Or all of my kids, 15 months, they never walked, they ran. So as long as the other developmental stuff is in line, it is not a problem. Because what about kids? They're all different. Now, nutrition. Well, at first, we know mom gives all the iron to the baby in their blood because red blood cells carry oxygen and iron, right? That comes from mommy. Well, we have to maintain that iron because that's the strength, right? That's part of the nutrients that the body needs for growth. So we're only going to breastfeed. And if we breastfeed, we're going to be given vitamin D. Okay. And if we're doing iron fortified formula, remember it's always iron fortified because we have to give that iron to that child. As I said, they lose 10% of their body weight. But one of the things, especially new parents that are breastfeeding, I don't know if my baby's getting enough. He didn't really nurse that long. Did he get enough food? Is he drinking? Oh my goodness, should I give him a bottle too? Well, as long as there's 6 to 8 wet diapers, including stool, we know that that baby's doing good. Now, why don't we feed a baby for the first 6 months? Well, there's all different things that's gone on through the years. When do you feed them, etc. But the reason is their GI system is very immature. It doesn't know how to absorb and use the food. You know, even at 6 months, when we start feeding them food, you're going to see pieces of vegetables and whatnot in their stools. Well, just think about us. Have a corn on the cob, you're going to see corn the next day, aren't you? Well, same concept with these babies. So, introduction that second 6 months. Now, first of all, when we start feeding foods, we usually start with rice cereal. It's the least allergenic of all the foods. So we start out with rice cereal. Now, do you do fruit? Do you do vegetables? What comes next? Usually it's a physician choice or a parent choice. But the thing is, one at a time, 4 to 7 days in between each addition of a new food. Also, you are going to give food before you give them milk to make sure they're getting the food. We're trying to wean them off the breast. We're trying to wean them off the formula, okay? One of the things we can do as, quote, a dairy product is to give a soy-based yogurt. And that is a dairy alternative. And that is used by some parents. And at 1 year is when you can start whole milk, not 2%, not skim milk, whole milk. They need the fat for their central nervous system. So food sensitivities, we know that some children are more apt to have sensitivities than others. Sensitivities could be rash all over, could be spit up, vomiting, diarrhea, cramping, like colic type stuff. Diaper rash is one of them too. Those children who have all of these sensitivities actually have atopy, which is they have more of apt a tendency to get things like asthma, dermatitis, those things. So if you have a child who's sensitive to food, it's something for them to look at. We know usually food sensitivity initially is we're just going to be those rashes and maybe vomiting, diarrhea. But remember, it could get to the point of anaphylaxis. That's why we don't give things like orange juice yet. We don't give nuts, strawberries. Why? They're high in those chances of being allergy to them. My grandson is a absolute tree nut, and he goes swollen quick. So I'm very aware what it looks like. At first, babies sleep a lot. Formula-fed babies sleep longer than breastfed. Usually breastfed or every 2 to 3 hours feeding is just because of, I think the formula is a little thicker, okay, has more substance to it. But we know breastfed is usually what we always recommend is the best if a mother is able to do that. We know they're taking multiple naps. They say you don't need walkers, swings, and playpens. I used all of them. Again, it is in the book, but it is a parent choice, right? Dental health, usually the first month that you usually see the start of teeth, and in not all the babies, is at 6 months. So they say at 8 months, you should have 8 - 6, you should have 2 teeth, is what they're saying. Um, doesn't mean all kids have 2 teeth at 8 months. Again, my children never had teeth at 1 year, but at 15 months, they got 6. So that is normal too, okay? Now, when they start getting teeth, you take just a wet toothbrush and scrub it. They also say just a warm washcloth and rinse off the teeth, especially going to bed at night because it keeps that milk is sugar. It is a carbohydrate. Get those teeth and keep them clean. That's why we don't do any bottle propping or give fruit juices and leave them in the crib at night. The one thing that would ever be put there would be water, but you don't want them drinking, especially younger, because they could choke. They say use a pacifier. And again, it's a parent choice, isn't it? These are all those immunizations. What can I tell you about these? Well, we know that we do it 2, 4, 6 months, as many of these. Remember, influenza is, a disease where it's a lot of mucus, a lot of fevers, and it does, I mean, think about how we feel, how an infant would feel. We cannot give that immunization until they're 6 months old, okay? And we would at 6 months start that. Colic is really hard on parents. Usually after 2 to 3 months, they grow out of it. But it's a kid who cry, always with gas. I mean, we'll do everything to try to eliminate the gas. We'll give, like Milacom, gas drops. We will have them sitting up, burping them. We will make sure that they are, not overfed, burping in between feedings, all of these things. Sometimes it doesn't matter. And these poor parents, they're exhausted by the end of 3 months with a child who has colic. Some kids sleep a lot, some kids don't sleep at all, right? And then there's something called failure to thrive. Failure to thrive is when we are doing what? Well, in pediatrics, every visit, what do? Whether ER, urgent care, doctor's office, we do a height and a weight, don't we? If we're seeing a baby born at 7 pounds and it's now 5 months and they're weighing 10 pounds, there's a problem. They should be weighing 14 pounds in the next month. So that is considered a failure to thrive. And it will be looking at what are they eating, a big evaluation if it's not just the food. Many of these are brought to the hospital and looked at, reflux and all these sort of things. So failure to thrive, they're not getting nutrition, and nutrition, right? They're not getting it, they're not growing, and cognitively, they're not doing what they should do. At 5 months, they're not turning over. At 3 months, they're not lifting their heads. And these are things that we would say. We have kids that are born with flat heads. Some of the newborn children, they're only on one side, flat on one side, or now with SIDS on their back, the backs are flat. What would we tell a parent? Well, they promote 1 hour a day of what we call tummy time when an infant is wide awake, right? These skulls are so soft and so malleable that their flatness will disappear because of this little bit of tummy time. It does work. There are those helmets that you see right there on that baby on the bottom right, and some physicians do put them depending on the condition. Diaper rash, this could be due to food or the wipes, the soap, the lotion, diapers was the one that it happened in my house. My kids didn't like Huggies. The other kids liked diapers. And then my grandson liked Huggies and didn't like Pampers. So it is again a trial and error. Now, you have an infant that has a diaper rash. Guess what? That's an infant that's going to keep you awake at night. As soon as they stool or urinate at night, it's going to burn. And guess what? They're going to wake up. So we try to treat that as quick as possible, trying to figure out what is the cause. having them time with their diaper open during the day. And maybe it needs some prescribed medications on there. Maybe it is a yeast, right? And we need some prescribed medicine. And the other thing that I think bothers us, especially if it's a little girl, we don't want cradle cap because we want little bows and stuff in their hair. And now you've got all of this crust on their hair. And you'll have parents say, how do I get rid of that? Do I have to scrub it off? Well, no. You use soap and water. And I've seen some books that say put mineral oil on at night and then in the morning give them their bath. And then take a fine tooth comb gently and comb the hair. And eventually all of that cradle cap will go away, okay? Now, I did mention SIDS, just briefly, but SIDS, big, big thing for the first year of life, up to 1 year old. What are the risk factors? Well, males are higher risk than females. And I think the other one that I need to mention right now is breastfed babies are less apt for SIDS than a bottle fed. So that's one of the reasons why we want them to breastfeed if they can. Cigarette smoking, not only is it SIDS, it also has with ear infections too. So no cigarette smoking in the house with babies. If they've had some sort of upper respiratory nasal discharge thing, then again, what does a baby do? Suck, swallow, and breathe. Put some mucus in the nose, and let me tell you, it's going to be, could be a SIDS death on that. Of course, we don't want any baby sleeping on their tummies, and we want them on their back, and we don't want them overheated. And they also say no cohabitation in the bed with parents. And many parents sleep with their infants. I will tell you, I had one father, and he was a larger man, but he rolled over on his infant at night and suffocated the infant. And I was that trauma nurse when that baby came in. It's really sad. So we always say no cohabitation. What is an ALT? Well, ever have a baby all of a sudden gag and choke and turn blue? Well, that is called an ALT. Is it a reflux or is it neurological? See, you can't rule it out by saying, well, eventually I blew in the face or I patted the back and the baby stopped and turned pink again. It's that event, that apparent life-threatening event, ALT is what we call. And it's also what we call a missed SIDS. Now, they go in and do a GI workup and a neurological workup. We call it the $1 million workup for the ALT event because they come in, they're admitted for almost a week in order to get all these things done. And they're sent home with an apnea monitor. Now, apnea monitors today are easy to use. It is a Velcro strap that goes over the nipple line. It has two leads. One is for heart rate and one is for respiratory rate. And if it drops below or even above, if you set the alarms, it will make an ear-piercing scream. And that usually wakes up the infant and hopefully will wake up the parent. One of the biggest things that is unintentional injuries is motor vehicle in all age children from infant through adolescence, okay? So making sure a child, especially infants, rear facing, snug shoulder straps, taking baby blankets, rolling them up, propping that infant so they're not sliding down and that they are held securely, okay? Those are things. And then, of course, not using expired seats. You can't have one that you had 10 years ago, pull it out, try to use it, because actually they do expire. And the one thing that we do try, especially today, is at least give them basic CPR. Babies choking, what do? Turning them over, pat their back, and as they get older, and that can help. I know my son was eating one of those little sausage baby things, and he got it choked. And thank God I'm a nurse because they didn't teach CPR back then, so I was able to get it out. But can you imagine? for a parent who has no clue. So Letitia's breastfed, and she's seen at her clinic for a 6-month-old checkup. The mother tells the nurse that Letitia recently began to suck her thumb. What's the best nursing intervention? What do infants do at least the first year? How do they self-soothe? How do they explore the world?
Would the answer be C?
Yes,
C.
it is. Absolutely. Then I had another person say, well, should we encourage them to suck their fingers or a pacifier? Well, the recommendation is before they get their permanent teeth, everything should be out of their mouth. So that's about 6. And some cultures have pacifiers and they're 5 years old. It should be stopped before their new teeth come in. All right, somebody asked me about theorists. We're going to go into them. Now, infants. And you need to remember what those stages are called, okay? So some questions will have the stage and some will say, what does that mean, okay? Now, what does a baby know how to do? They can coo and they can cry, and that calls somebody, right? When they coo or cry, they want somebody, whether they're hungry, whether they're dirty, whether they have gas, whatever. They want mommy or daddy or whoever. Somebody goes, picks them up right away, and this is going to be a happy, well-adjusted infant because their needs are being met. Okay? Mistrust is when, not one time, but all the time, they cry, 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 and nobody comes. I mean, this can happen in some environments, let's say there's drug abuse, alcohol abuse, or other things that can occur where the baby is the last person on the totem pole. And that child is not going to be that happy, smiley baby all the time, okay? Now, cognitive development, Piaget. Initially, it's all about those reflexes, right? So, first of all, you have that reflex palmar. That's nothing to think, it's an automatic. Well, then it becomes voluntary. So, here's the rattle, you put it next to them and they grab it. Now, that's usually the first part of the sensorimotor phase of Piaget. Or they're there and all of a sudden their thumb, finger sticks in their mouth and they start to suck and they go, oh, I like that too. These are things that they didn't know. Nobody showed them. It's just they found it, they like it, they continue it. All right. As they get older, it's more of imitation. That's when mommy and daddy are playing and rattling the the rattles and shaking them. The baby will shake it. It's the baby's cooing. I know you can look at them, you stick your tongue out at them, they'll stick it back at you. It's that imitation. It's that play that we do. So you can see they're building on their learning. Pre-operational, we're going to go into the toddler when we get there, but this is now, we've taken things we're learning. Remember, toddlers are an exploration kids. They're into everything all the time, but they're learning and building upon just the initial in the mouth, right? Now, things like, as I said last week, taking a sippy cup, it accidentally fell on the floor. Toddlers are ages 1 to 3. They're sitting in high chairs. It fell on the floor. Mommy came, like, ha, now I know how to get mommy. This is learning. Concrete, you have to see it, know it. Formal is when you could figure things out for yourself. And that is only the adolescents. They, as I say, they can fight their way out of a paper bag and get out when they are not supposed to. So as we keep going, they're starting to understand about their body. They're looking in mirrors. Again, Everything in the mouth, right? Oral. This is the way they're comfortable. Something else happens at this time, and again, it's cognitive, about object permanence. We as parents play with them, take the teddy bear, the rattle, put it down next to them if they're tummy time or even in the crib, and they know it's there, even if they can't see it. So object permanence means they're going to be looking for it, even though they can't see it. I mean, as they get older, the toys get put away at night. They know in the morning they go to the toy box, pull it out, right? That's still object permanence. Now, we know children, infants are attached to certain people. Could be grandma, grandpa, or a best friend that's always over, mommy, daddy, right? That's just part of it. Separation anxiety is 3 stages, and it starts between 4 to 8 months. And what it says is now, many young infants, for whatever reason, need to be admitted into a hospital. It doesn't mean mom and dad can stay there all the time. It would be ideal, right? But let's say you're a single parent, you have to work. You have to leave your infant there while you go to work and then come back at night. Well, that's when separation anxiety would show. What would a baby do initially when mommy is not there? They're going to cry, right? And then after they cry and cry, and mommy and daddy aren't there, and you have the nurses trying really hard to figure out how to satisfy and take care of them, all of a sudden they stop crying, and a lot of them, even as they get older, like into toddlerhood, they will stop crying and regress. A toddler might all of a sudden start wanting a pacifier again, or start sucking their finger, or if they're potty trained, they're going to maybe be incontinent. This is normal. And then the third stage of separation anxiety is when finally mom or dad comes in and the baby don't pay any attention, or the toddler don't pay attention. And those are the 3 stages. Stranger fear is that first day in daycare, right? You take your baby, hand him over to the daycare worker, and they're like turning around and want you. It's because they don't know who they are. It's very much part of the learning, and eventually the infant will learn that person is okay. That language development starts with the coo and the cry, and all age children play. Even that newborn is learning how to grasp a finger or starting to coo and cry, and these are all part of play. So toddlers, I love toddlers. These children, you cannot slow down. This is what Seinfeld says. Having a 2-year-old is like having a blender without a lid on, and turn it on. They're everywhere all the time. It's intense exploration. This is what we call terrible twos. Well, no, 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 me, mine. And it's temper tantrums. I don't want to share. This is parallel play. They don't share toys. You could play next to me, but don't touch mine. These are mine. Grabbing things out of other kids' hands, that's mine. That's all part of being a toddler. Normal. Now, whereas infants, they gain a lot of weight quickly because they're growing quickly, from now on, it's really, really slow. So birth weight doesn't quadruple to 2.5 years. So you can see how it does start to really slow down. Their body systems are becoming more mature. They are getting ready for potty training, right? What is the big thing that kids are always getting? Ear infections, right? Tonsillitis, because everything in the mouth, most of these kids do have to go to daycare. Now, what does daycare do for kids? I call it where they go to daycare and all they do all day long is swap spit, right? This toy given to this toy, given to this kid, and they share it. Now, is that a bad thing? Well, we'd like it to be as clean as possible, but realistically, can you, constantly be with a rag cleaning and wiping everything up all the time? It's not going to happen. But these kids are getting sick now. So by the time they get to school, a lot of them have built up immunities to this, right? Body temperature is not a problem, and we know that it starts that potty training, and it starts with bowel training first and then bladder. Gross and fine motor starts to be getting more and more refined. Well, at 12 months, they're rocking back and forth and wobbly. Now, by 2 to 3 years old, they're walking and running, and you don't see that awkward sort of gait that they have. By 12 to 15 months, they're going to be using both hands. And by 18 months, they're throwing balls. And I know my grandson, the first ball he ever threw missed my head, and it was really hard. I think I would have been hurt if that ball would have hit me. So that binocularity that you have as infants is corrected. The eyes are working together now, and their visual acuity is pretty good. Their depth perception, of course, with that, it's going to be good. Now, one of the things about toddlers, they become picky eaters. Have you ever tasted baby food, baby cereal, baby formula? It is really not the nicest thing to taste. Well, infants don't have that taste bud yet. It's immature. Well, infants now turn into toddlers, and toddlers do have that ability to now taste. So they become picky. So they are going to choose their foods, what they want to eat, and they're hardly going to eat. So it's not something to be concerned about. They're exploring hearing, smell, taste, touch, all of these things. Now we're exploring the environment with everything. Now, Erickson, toddlers, autonomy versus shame and doubt. What does autonomy mean? When you're autonomous, automatically me, mine, I do, okay? No, mine. Another thing about autonomy or being automatic is that they need rituals, as in they need to know what's coming next. They need to know foods, what time, routine. They need to be on a schedule. That makes them feel sense of comfort, okay? And again, they're in the id, as in all about me. They're not thinking about other people yet. What is shame and doubt? Well, what happens when your 2-year-old's on top of a couch, ready to jump and dive over onto a pillow on a floor too far away, and they're going to bop their head? The grandparents are going, be careful, you're going to be hurt. Or if they're riding their trike down the street, be careful, watch out, don't do that, don't run over this, right? That's the shame and doubt. Autonomy, they want to do everything themselves. Shame and doubt, somebody's stopping them from trying. So Piaget, what we started out with was those simple things, right? As we get older, it's going to be more about, in the toddlers, it's about things like that sippy cup that goes down, and they learn that. It's also they're going to figure out what they need to do to get your attention. They don't know time. They still don't understand it yet. And that gets more into the preschoolers. So we've got Erickson is all about no, me, mine, being on a schedule, a ritual. And then Piaget, starting to learn, experiment, figuring it out to get the attention. What do they need? Again, thinking. Same sort of thing for you. There's the picture, picking up the rattle, it shakes as an infant, finding out their finger is good at infants, And then it goes into throwing it on the floor, mommy comes. Now, as a toddler, they're starting to understand a little bit about boys and girls. They probably have gone into the bathroom and watched mommy or daddy, go to bathroom and realize that there's a difference. And of course, they're going to start touching themselves. It is normal. Now, what we should do is say, don't touch yourself. If you want to touch yourself, go in the bathroom, or go to your room. We don't need to see you do that. Not to make it a bad thing. They are going to start playing house, mommies and daddies, right? Girls and boys, to figure it out. Separation, they're starting to know that when there was somebody that's not mom and dad, it doesn't mean they like it, but, introduced, they'll be okay. And then their individuality. Now, transitional objects, important. You have a toddler, let's say you're a nurse in a hospital taking care of a toddler. Wouldn't you want to know that this is their favorite pacifier, or this is their favorite toy, or if this blanket is not next to them, they will freak out? Those things are important to know. Those transitional objects that make them feel good. As they get older, it could be jammies or a blanket or something. But those things, kids tend to have something that is familiar to home, right? Toddlers understand a lot, but they can't express it, and it gets frustrating for them. So by 2 years, they are doing multi-word sentences. At 1 year, it's one word, mama, dada, usually, or milk, whatever it is. So that's what you see in your language. And they keep building it up more and more and more, that language, as they get older. Um, Again, they're independent. They want to feed themselves. It could be the spoon upside down backwards, but you need to let them try. They say by 2, they should be able to feed themselves. And remember, when they feed themselves, 1 tablespoon of food per sitting is all they need. So we think they need more because they ate more as an infant as they are eating now, right? And also, toddlers are start realizing other people. You never have a toddler who sees mommy don't feel well and they give mommy a hug, or fell down and brother got a boo-boo, say boo-boo all better. These things, they're starting more and more to understand others, just slightly now. Toddlers don't like to share, right? So this is parallel play, next to each other with their own toys, not sharing. Okay, very important. We know play is very, very important. Imitating other people or different textures, sand, dirt, water, whatever it is. That's all part of that Piaget learning about stuff. Toilet training, they need to really want to do it. And they need to start knowing when it starts with their bowels, okay? They can feel that and control that first, and then go into the bladder training, okay? We know there's always fights between brothers and sisters or siblings. I had 6 brothers, so for me, at least I was the only girl, so it wasn't that bad in my household. Temper tantrums all the time. But we know toddlers don't want to go to bed at night, right? They want mommy to come in, lay down, fall asleep with them, read a book. I want another book. I need to go to bathroom. I want more water. It's all of those things. So these things can happen. Remember with temper tantrums, and especially things like in a grocery store type thing, they fall on the floor and their arms and legs and they start screaming. Well, what they say in the book is to ignore it, that behavior, because they want you to, um, look at that behavior. They want attention. So don't give them attention unless their behavior is going to hurt them or others. Okay. We know it's the no, no, me, do all the time. That is a toddler. And then we know that if they are stressed, let's say they go in a hospital, you will see regression. You'll see them, a kid who hasn't had a bottle wants a bottle, not a sippy cup. You're going to see a kid start sucking a finger, and again, things like being incontinent when they're potty trained. As I said, nutrition, they're not hardly eating at all. Okay, we call it physiologic anorexia. I know my grandson was here with my husband. It was our choice to keep him home with the child. And I'd come home from work, and my daughter would come home from work when she was still with us. And he's not eating anything. He only ate da, 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 da. And I'm like, it's more than enough. And he just didn't understand. He wanted to feed more and more and more. So you have to describe it to him. 1 tablespoon per sitting is good enough. Now, sometimes we do have deficiencies. So remember, whole milk can give calcium and vitamin D. Another thing we need to remember, if a kid has wounds or has had surgery, they need increased protein, right? What is protein good for? Wound healing. There are cultures that like complementary alternative medicines. My husband is Jamaican. He loves ginger garlic teas for everything. Now, that's okay in a lot of things, but remember the G's could have a problem with bleeding coagulopathies, right? So you've got to be careful. Does it affect the child? Can it affect the medicine that they're getting, the regular type Western medicine, Eastern medicine? And we know sleep is always a problem with toddlers. You got to have a good bedtime routine. Their teeth are in when they're toddlers, making sure they get to the dentist, make sure that they floss. Um, they say a child who's 6 years old doesn't have the dexterity yet to floss. So parents should help up to then. But before that, parents can do it for them. Brushing their teeth with fluoride can help childhood cavities. Now, children and toddlers get into everything, right? What do kids do? Let's say, for instance, you live in an old city, Chicago, New York City, or any older city, an older apartment, from the 50s, 60s. We know there's lead paint there, right? What do kids like to do? They see a window and they see a windowsill and they're teething. What are they doing? They're chewing on that windowsill. Are they getting lead? It could be a possibility, right? So that's always a concern that if we know a parent lives in an older building that we should mention, and there are easy lead tests today that we could do, okay? They have medicines and they have apheresis machines and stuff. So all these can be corrected. Children love to put everything in their mouth, right? And it doesn't matter. They don't know if it's underneath the sink cleaners, Tide, those little balls of Tide things. I mean, yes, the adolescents, did it as a gimmick, right? But toddlers do, not knowing, put it in their mouth, you know. Um, Also, medications. I think the most tested medication that I've seen come into an ER with is Flintstones chewable vitamins. And why? They taste good. Is it bad to eat all of them? No, you get more vitamins in you. What you don't need, you'll just urinate it out. But if it has iron, that could be a problem, right? But what if it's Tylenol? Tylenol can kill your liver, right? Hepatotoxic. So that is something. What would you do if your child, any age, took something and ingested it and then they told you about it? Well, we don't believe in Epicac anymore. We don't believe in vomiting. Number one, call poison control. Every parent should have that number on the refrigerator, in their phones, everywhere where they have a kid, because it could be as simple as drink a glass of milk. But again, that will guide that parent doing the correct thing because kids get into everything. As I said, motor vehicle safety. I've talked about how to do the car seats, rear facing, those good chest restraints, using blankets if we need it. Drowning. I think every parent should have a course on water safety. You know, little Christian, by 2 years old, when he lived in my house, could do front flips off the ladder, no swimmies, and he never, ever drowned it. But he'll never go in that pool alone without asking first. And he's 7 years old now because he did it one time. And my husband went crazy. And he never wants to hear him go that crazy again. So it was a learning experience. I have seen drownings and I've seen severe hypoxic episodes and what it does to children. We know burns, handles, we know falls when they're 6 months old, make sure that they're not going to fall and roll over things. And of course, keeping things for aspiration, all of those dry cleaner bags, etc. Be careful of those. I've already mentioned car seats. Refinement and coordination. We know that's going to be that 12 to 15 months. That improved manual dexterity is going to be that 2 to 3, throwing a ball, it's at 18 months. So let's go into preschooler. Now, what ages are preschooler? Well, up to this point, all your pain scales are FLAC and nonverbal children, okay? That was a HESI question. What would you use for a nonverbal child? It's FLAC, isn't it? Well, at age 3, preschooler, ages 3 to 6, this is where we start the FACES scale. And preschoolers can now talk better and they can tell you what's going on. We know preschool is that age where we start getting them ready for school. How should parents be told, to get them ready? Is they should read to those children daily and have a really good attitude towards, school. That sitting down and looking at books, it's actually starting to increase their attention span because up to this point, they don't have one. Same sort of thing. Body's slowing down. They're growing, they'll plateau, gain weight, then they'll get taller, gain weight, get taller, and it's just exactly like toddlers. Gross motor skills. Now, we've gone from that clumsy, awkward toddler. Now we are walking, running, jumping, climbing really well. Okay. Fine motors. As we get to 3, 4, 5, 6, they're doing more and more refined. But again, they're drawing, they're dressing. A 3-year-old might have a shirt or everything inside out and backwards, but by 6, they know where tags are and they have the shirts on the correct way, right? So part of that. Okay, Erickson preschooler, developing a sense of initiative. Well, preschoolers like to help. They want to do things. They can follow simple commands. And they know that they want to do things the way that they think that they should be done. And they get really concerned that they're not doing things the right way. Now, this is when they develop super ego, which is literally Kohlberg, which is right or wrong and a consequence for that action, which is reward and punishment, isn't it? Cognitive development, these kids are getting ready to school. What do we do for this? Well, we're going to have these kids, hopefully they're going to be in play groups or in gymnastics or, out at the park with other kids, whatever it is, getting them ready. That reading the books, that coloring, those colors, all those things that parents do. We know that they are starting from at this point as a preschooler. It's not so all about me, 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 me. It's also thinking about other people. This is where the sharing comes. This is when associative playing starts, where they can play all together. Doesn't mean that there's a goal when they're done, but it is playing together. We know that they understand if they do something wrong, there's going to be a consequence. Now, concept of time, what do they know? Time is related to events of the day. After lunch, when you wake up, before dinner, after daddy gets home from work. That's what they know. They don't know at 12 o'clock, we're going to do this, at 6 in the evening, or when the sun comes up tomorrow. Those are things they understand. That is concept of time. It's related to events. They are the kids that sit there and play, talking to themselves, floating cars and dolls and blocks in the air and talking, and another one in this hand, and they're talking to each other. All magical thinking. It's actually fun to watch. As I said, Kohlberg. Kohlberg always is involved in cognitive awareness because it is knowing cognitive about right and wrong. But this is Kohlberg also says this is the age of rewards and punishment. This is your preschooler. They start getting aware of differences, right? They start noticing blonde hair, brown hair, dark skin, light skin, blue eyes, brown eyes, skinny, tall, fat. They're understanding all of these things now. Now, one of the things about preschoolers, they think if they get cut and there's blood, they're going to bleed to death. Their insides are going to come out unless they put a band aid on it. This is the age of band aids. I can't tell you how many different characters I have in this house. There's SpongeBob, and there is Batman, Spider Man, Paw Patrol. Okay, which one do you want today? Go get your band aid, right? And it cures everything. Now, they're afraid of things that enter them, right? Surgery, they'd be terrible afraid of because they're afraid if you go in, their insides are going to come out and they're going to be dead. That's exactly what they'll say. Or what do we do every time if we're in a doctor's office with this preschooler? Every time they see us, we're sticking a needle in them, right? So they're afraid of that. So again, you got to remember those things like how to approach him, how to make it less intrusive, how to make it less painful, right? Spirituality is what the family has taught them at this point. They don't really know what's outside the family at this. It could be Santa Claus, or it could be going to church in the manger. It could be, um, Easter bunnies or Jesus on the cross. It's whatever the family has taught them. But they believe in something higher than them, whatever the name is. You'll hear a lot of them think it's God or the higher, whoever the higher power is. They think when they get hurt, fall down, scratch their legs, or get a bruise, they think they're being punished for bad behavior. Not uncommon in preschoolers, not uncommon even in your younger school age children. They're being punished. I hit my sister yesterday. That's why I fell down. That's why I broke my arm, whatever. Sexuality is still learning, boys, girls, they're starting asking about sexual reproduction. And what I say that is say, so where do you think the baby's coming from? Mommy and daddy gave each other a hug. You got to put it in a developmental appropriate level for the child. Find out what they know first. They probably don't know too much, and a hug will be just good. So things like that. Again, questioning these kids. They're very smart. Stranger danger and that fear of separation are better because they know they've been left places. Mommy and daddy comes. Again, security from those familiar objects. That means they still maybe want that pillow, or maybe those jammies, or maybe a truck or a stuffed animal. These things are important, especially if they're in a hospital, all right, or going through a procedure. And of course, play therapy. Today they have something called child life. And then I started to see them come out in about 2009, I want to say. All of a sudden, there was these people in my rooms talking to my kids in the ER, and I'm like, "Who are you?" And I found out they are extremely well educated people on growth and development and child psychology. And they sit there and they know how to approach children, how to show them equipment, and how to alleviate fears and to assist in things. I've seen them assist in spinal taps, in suturing on amputated fingers. Kept that kid somewhere else that they're not paying attention to what's going on. Child Life is an amazing group. Their language is amazing. It is growing, 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 growing. And some of the words that come out, do they really know what it means? I think the big word that I remember was teleporting, was one of the things that Christians, I'm going to teleport over here or there. But you're going to hear some words, 4 or 5 syllables. Where'd you learn these words from? They're knowledge soakers. They're like sponges. They're not as into routines as much as toddlers, okay? These kids are easier to take on vacation because they don't have to sit to certain routines and they'll still be happy, okay? They can dress themselves, they want to please. Again, their values are all what's been taught to them by their family. But they're going to start to try to challenge. Well, he doesn't go to bed till 10 o'clock. Why do I have to go? They're going to start challenging. Or they didn't put their sink in the dish in the sink. Why do I have to put mine? They're going to start challenging things like that. Sex education, we've talked about it. Just in, sexuality, find out what they know and then, make it on their level. We know masturbation is absolutely common at this age. You might see two preschoolers in the bathroom sort of going to the bathroom together, sort of maybe looking at each other. How should you approach that? Unless it's something really extreme, just say, come on, let's go play here, and just stop them from that activity, okay? One of the things is they're afraid. They do have a lot of fears. They don't like the dark. They don't want to be alone. Don't walk out of the house and that kid can't find you. They'll be screaming for you. They don't like large dogs. They think they're going to eat them up. And of course, ghosts. Why are there ghosts? Who taught them about the ghosts? Because yes, they are afraid of ghosts. And look at this: objects or people associated with pain. Guess who that is? That is nurses. That's the medical personnel. And we know how to decrease those fears. If they have problem with speech or stuttering or whatnot, speech therapy. It's great. It works good. I know my first two grandsons had speech therapy, and the kids are smart as whips today. So, and that you can't stop them talking. But again, starting it as early as we know it will catch these kids up quicker, and they'll never feel less than or behind other kids. Sleeping through the nights, you're going to see things called night terrors. My second grandson, I was staying at his house, and in the middle of the night, he woke up screaming and yelling. And I didn't know. His mother didn't tell me. He had night terrors. And he's still asleep, but looking awake, screaming and yelling. And it became a problem where they had to think of what to do to help him. And they put him on something simple like melatonin. And that did help. But they do grow out of it. But it was not nice to watch this poor kid so afraid. And mom just had to rock him and calm him down. Preschoolers do like routines for bedtime. And they know that, okay, before bed, let's watch a little show or let's read a book. We stop the drinks, after dinner, no more, those things. It becomes that ritual bedtime. And then many of these preschoolers, you can leave them in their room and walk out. Of course, there's other kids or not, but we're just talking generally. Injury prevention. Now, preschoolers up and out and moving, right? There is an increase in pedestrian motor vehicle accidents, as in they're in driveways, they're chasing balls into the street, they're in parking lots around motor vehicles, and they are being hit And I have seen more kids ran over by a car than I want to imagine. And I've seen good outcomes and not so good outcomes. So again, children at this age really need good education on motor vehicles because it will happen. And when we are letting them out, doing rollerblades, riding bikes, helmets, elbow pads, knee pads, whatever they need, we should encourage protective equipment. We know that kids go into school. We know that we have to give up control as parents, right? So again, letting the children know that this is what's going to happen because we prepared them. We've read books, we've done numbers, we've done colors, we've done all of this stuff, and we get those kids to school. Communicable diseases, we know, years ago we had a lot. Immunizations has decreased them a lot. Now, there's one of them I'm going to mention, and it's chickenpox. Now, chickenpox, we have immunization about 15, 18 months. We know the varicella vaccine, but kids still get it. Now, twofold thing with that. If you ever work in a physician's office, you ever work in an ER urgent care, you have a kid come in with a fever, has an itchy, burny rash that has macules and papules and oozy, juicy, suspect chickenpox. So first thing, you put on an N95 mask, okay? Because it's all airborne. And then get that child into a reverse airflow room, an isolation room. The air doesn't come back in circulation, it goes outside, so it doesn't spread it, okay? And remember, prodromal, what that means is before the rash appears is when these kids start to be contagious, usually 4 days, 5 days before the rash. So then the rash comes and then they know they have it. So that's when they spread it, okay? And always, how do we decrease the incidence of disease? Hand washing, hand washing. Conjunctivitis, big thing with the kids, right? Always the fingers somewhere in the eyes, rubbing them, and they get these goopy, droopy eyes. So again, clean them first with a warm, wet washcloth, put the medicines in. Remember, ointments, tell the kid it's going to be blurry vision. I mean, even your adults, because I can't see, and they're going to freak out on you, especially if they are at the preschool age, all right? And then just between you and me, it's not in the book, it's something I did, tell parents to change their pillowcase every night because you don't want them putting their head down in that contaminating pillowcase from the night before. So that's just me, one of my things. Stomatitis, all of those mouth sores, again, they hurt, it's pain relief, and also uh, decreasing the spread of infection, hand washing, right? Pinworms, Geodartis, and Pterobiasis. These are roundworms, little worms. What do kids do? They go outside, they play in dirt, and they get it underneath their fingernails. And where do kids put their hands? In their mouth, right? Preschoolers do, school age do, everything in their mouth. How do we get a diagnosis? Let's say those pinworms, they could be itsy bitsy tiny. Now, they say at night, go into the child's room with a flashlight, open up their butt cheeks and take a piece of scotch tape on their anus and then pull it off. Usually you'll see an itsy bitsy tiny little something, this little white thing. Put it in a container or a baggie somewhere, and then you can get medicines for it. Remember, if a kid has it, the whole family should be treated because usually the whole family will have it. Child abuse, neglect. I wish I never saw it, but I have. It could be deprivation of food. I've seen that. I've seen emotional neglect and I've seen physical neglect. What is our job? Well, when we are seeing something that doesn't match, the injury does not match what the parent is telling you how it happened, we should suspect child abuse. And as a nurse, what would we do? I mean, I've seen a 3-month-old with a cracked cranium, okay, the skull, and had bruising behind the ear. And when I picked that child up easily to put it on the scale to weigh, I felt my fingers slightly go into the skull. And I went, oh boy. In suspicion, what did we do? Well, I told the charge nurse, I told the head physician, and actually, I personally escorted them over to CAT scan and did the CAT scan. Found it was a fracture, and the doctor said, if you find it, go ahead and do what we call a bodygram. It's a 3-month-old. It fits on an x-ray plate. What did I find? Fractured humerus, fractured ribs, and a fractured femur on a 3-month-old. Well, the end of the story is that that child is safe today because I alerted when I first saw it. I'd rather be safe with a child's well-being than to say, well, I don't know and I don't want to say it if it's not. It's better to be safe than sorry. And then the other thing with things like you see sexual abuse, a lot of times it's not the parents, and the parents are bringing these kids in. Make sure as nurses we're supporting the parent. They're going through a lot, bringing their kid in with their child with suspected sexual abuse. Okay, remember the child and the parent. Now, there's something else that we call Munchausen syndrome. Munchausen syndrome has happened where the parent likes the kid being sick for the attention. She does crazy things like taking toilet bowl water and putting it in an IV, or taking stool and putting it on open wounds, all sorts of crazy things. I can't even go into what all it could be. What is our job if we suspect Munchausen? Well, anything that goes into that room, if they're in a hospital, make sure that we check it. And number two, they should never be alone with their child. Protect the child. Our job is always protect the child. So physical abuse, I went into, and again, when they're done with this abuse, the physicians, will recommend some sort of therapy for this child. So a 3-year-old daughter and a male cousin of the same age have been inspecting each other closely in the bathroom. Which of the following is the most appropriate response by the nurse? Do 3-year-olds look at each other?
Is it B?
B.
B.
Absolutely. You don't condone it. You don't condemn it. You say, come on, let's go. Let's do a coloring together. Or here, let's go do this together, right? You don't bring attention to it. It's normal, okay? As much as we don't want it, it's normal. All right, let's go to for some codes. Any questions so far? I'm going to try to run through this quick. Now, if I start going too long, you can stop me, okay? Because there's 60 some odd questions. Yes, you're going to get the codes. So I'm going to go pretty quick. Remember, you always have the recording to go back to listen to if you need to. So anybody who wants some tutoring before exam 1, let me know. I mean, you're a Friday class, so we can actually do even the week of the exam, okay? I've had students come in the day before, and actually Thursday is a good day for me in the afternoon. So is Tuesday in the afternoon, usually. Here we go. Let's get going. There's 63 questions, I believe. I'm going to go quick. Infant, toddler, preschooler. Multi-select. Type of play considered to be sense pleasure play. Remember that sensor motor, right? They need that sense. It's part of that cognitive exploration, isn't it? Now, it is anything that you touch and play, water, sand, mud, what mashed potatoes. Playing checkers is when we get to that cooperative play, right? There's somebody wins. The nurse noticed white patches in the mouth of an infant that cannot be removed with a tongue blade. What should you do? Sorry for the spelling errors. This is probably thrush. If you can't get it off, it's probably thrush and it's going to need medicine. Now, they order nystatin liquid. You take a cotton swab and you swab it around the mouth. You don't use a syringe or have them drink it. It's just swabbing, okay? What type of play is considered cooperative play? I actually just told you. And that's checkers, because cooperative play, there's something that you win. Whether it's we're going to build a castle, we'll put the flag on top, that's a win. But usually they describe it as a game like checkers. There's a winner. According to Kohlberg, pre-conventional level of moral development, a preschooler who has moral reasoning, what? We know that we can do good or bad and both have a consequence. This is the age of reward and punishment. Which nursing action is appropriate to teach a preschooler child about a scheduled procedure? So remember, when we're ever going to a young child, number one, you want to get below them, never tower above. Then break the ice. Whether, oh, what a cute Batman shirt you have on. Oh, or I love your curly hair, your freckles, right? And then you can start talking about what you need to do with a doll or with the procedure. Let them touch, let them feel the equipment. Very good. Multi. What are some findings from a pediatric physical assessment? What is a physical assessment? Remember, there's a history and then there's a physical. Physical, you can touch and see and measure. Growth, review, and temperature. Vital signs. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Physical assessment on a toddler. What are you going to do? So again, you go in and the first thing you do is you start with minimal physical contact at first, as in you're talking to them, you're breaking open the ice. Then after you open communication, you'll utilize that play to let them, talk or tell me where your ears are, things like that. Play. What would you suspect if you note that an infant's chin is quivering? The fists are clenched, and they're inconsolable. You're crying, 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 crying. The other thing I'll say about the pain is if they're banging their head, they're telling you it's their ear hurts. Or if their hand is down their throat, probably they're telling you their throat hurts. So that would be the location. And it's the way children tell you those things. A multi. Erickson describes infants as trust versus mistrust. What does trust mean? So if they get their needs met, they're secure, they're happy, calmer, they know that somebody's coming, and they're happy kids. Three-year-old is having an outpatient procedure. How would you help the child to be less fearful? Approach on a child is probably the biggest part of nursing care. I worked in an ER and I had 4 rooms, and those rooms would change over 10 times in a day. It could. So you've got to get to those kids as quick as you can. So after you've gotten on their level, after you've broken the ice, again, give them a doll, give them the equipment, and those things will make it less fearful to them because they know what's happening now. No surprise. A multi. You need to do an assessment on an infant, and you walk into the room and the infant's asleep in the mother's arms. So what are you going to do? An infant's asleep. Or they're sitting very calmly, laying there in mother's arms calmly. What would you do? Well, we know if they're in mommy's arms, they're happy. So you're not going to have to come back later. In fact, perfect time asleep, listening to their heart, listening to their lungs, and maybe bowel sounds if you can, right? Because they're quiet. No cooing, no movement. You're going to get a good assessment. When do you switch formula to whole milk? And remember, whole milk. You're not going to say 2% or 1%. They need the fat for their central nervous system. And that's at 1 year old. A multi. When teaching about car seats for a newborn infant. The other thing I'll say is make sure those harnesses are tight and you could use blankets to roll up and get them comfortable in there and keep them safe. New car seats are good, rear facing, gently used. You would never use an old one because they do expire. There are expiration dates. Multi. When and how do you introduce solid foods to an infant? Seeing that picture reminds me of my son. That's what he looked like after dinner every night. He just loved playing with his food. That's why bath time was always after dinner, before bedtime. 6 months, one at a time, 4 to 7 days in between. Very good. Before assessing a 4-year-old child, what techniques would you use to approach this child? As a pediatric ER nurse, I used to have stickers of Princess, Batman, Spider-Man, Paw Patrol, whatever in my pocket. And that used to always be the icebreaker. I mean, kids, they always wear Batman, Spider-Man, whatever. Talk about it. And they're go, yeah, they like them. A 4-year-old will talk to you. Now you're cool. What technique can be used to examine a toddler? So use play to assess body parts, and that you can have them listening to you and you listening to them, and it becomes a play, becomes a game, and you're not threatening now. When assessing a healthy child's lymph nodes, what would you expect? A healthy child, what should they feel like? A healthy child, you should not be able to feel any lymph nodes. It's when they become sick, the immune system starts working and they get big. Nothing. Which Erickson stages of development levels would be used for a toddler? Remember, toddlers are those people are all about me, me, mine, mine. They don't share, right? Toddler. Autonomous, automatically me, 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 me. Yes, very good. What pain scale would you use on a 3-year-old child? We know 3-year-old, it changes to faces, okay? This is always a question on NCLEX and HESIs. This is an important question. Below age 3, it's flack. Faces, legs, arms, crying, consolability. As they get to be 3, they can pick a picture with a face on it, and they do it really well, okay? Multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So, what we say is that toddlers want to do everything all by themselves. They don't understand when things can hurt them, but it's the parents or other people that stop them, don't allow them to try, so they're not learning it. And that is what we call the shame and doubt. Gee, oh, why couldn't I do that? Ooh, I shouldn't have. And that's the shame and doubt. Remember, autonomy, all about me, I do. A 2-year-old boy is playing with mud and dirt. What type of play is this? That's all about sense pleasure. Remember, it's sense, it's touch. They love it. Sensorimotor. A parent of an 18-month-old boy says no to everything and has rapid mood swings. Is that normal for them or not? Absolutely normal. Remember, automatically they are, autonomous. Me, mine, I do. What is descriptive of a preschooler's understanding of time? We know it's related to the events of the day. After dinner, we're going to go. A 4-month-old infant is crying and shaking their head. What feature of pain is this infant showing? You'd be surprised that little infants can tell you what's going on. It's all about the location. If the hand down the throat, banging their head against the bed, that's usually the locations telling you, oh, my ear hurts, my throat hurts. A 1 month old infant's back of their head is flat. What would you tell the mother? I mean, we're in SIDS problems. We're, back to sleep on their back, supine. We decrease the incidence of SIDS death. So put them tummy time, 1 hour a day when they're wide awake and alert. A newborn's mother has type O positive and the infant's B positive. The infant is at highest risk for what? No, I can't put everything in the PowerPoints, everything in lecture. So I do put it here in your Kahoots to make sure that you get that information. And what it is the blood's fighting against each other. It has to do with an immature liver, immature cells, and they burst. And when it bursts, it spews bilirubin into the blood. And it's called hyperbilirubinemia. This is when you put the kids in the light, okay? And how do we decrease bilirubin in an infant? Make sure you keep feeding them. The more that they stool, the meconium comes out, and that will get rid of the bilirubin, okay? Breastfeds get rid of it quicker because they stool more. Which intervention may decrease the incidence of physiologic jaundice in a healthy term infant? Again, this is feed them. If you feed them, they're going to stool. They get rid of bilirubin through their stool. They say a breastfed mother feeding them within 1 hour of birth will decrease the incidence of jaundice in children, in the infant. Which intervention lowers the risk of sudden infant death syndrome? And SIDS is the first year of life. And we know back to sleep. Put them on their back. Infants crawl before they walk. This pattern of growth and development is called. They lift their head, they turn front to back, back to front, then they crawl, then they creep, then they walk. What is that pattern of growth and development? Yes, it's gross motor skills, but it's also called what? It's called sequential trends. We know if they're moving forward, they might skip a step, and that's okay as long as they're moving forward. How do you communicate with parents that do not speak a language that you know? I live in a town where there's a lot of Spanish and a lot of Haitian French. And how do I communicate with them? I was never exposed to all of that. And we know it's that good old phone. Never have an older child or somebody that's with them translate. They put their own meaning on that translation. You want it through the phone. What age would most children understand under, on top of, beside, in back of, around, behind, over, all of those things, right? And that's 4 years old. Some kids do it early. I know that, but remember, this is the book. In terms of language and cognitive development, a 4-year-old child would be expected to do what? 4-year-old preschooler. This is simple commands. Put your shoes by the door. Put your laundry in the dirty hamper. Put your plate in the sink, right? Those things they understand. What pain scale would you use to assess the pain of a toddler? Well, then you've got to know what ages is a toddler. Ages 1 to 3. Absolutely flack. Faces start at age 3, preschooler. Multi. What safety instructions would you teach the parents of a 6-month-old child? Well, what can a 6-month-old child do? That's what you have to think this question like. Safety. Are they crawling at 6 months? Are they creeping? Could be. So again, rear facing car seats, they could be creeping. So those outlets, and again, they're rolling. Don't put them anywhere they can fall off. Use a harness if you have one. Multi. What are the cognitive characteristics of a child 2 to 7 in the pre-operational stage? We know a lot of it has to do with, taking the sippy cup and throwing it on the floor, but I didn't describe as children use brooms for horses and sticks as swords. And, these are objects that are used for to play with that magical thinking. They don't understand you yet, what your point is. Their point must be made. And that imaginative, that magical thinking is there. A nurse receives a phone call. A mother's calling about a 6-week-old baby. He's crying a lot every day. She's asking, what can she do to stop this crying? 6-week-old infant. Remember, these kids are at risk. They really don't have any defense. They have no immunizations yet. They've never been sick. The thing is, you get a 6-week-old who has an issue, you should never offer information over the phone. They need to come in and be checked. It could be something more serious. A multi. What should an infant be able to do at 9 months? This is all about gross motor skills here. And there's fine motor there too. So they should sit without support by 8 months, okay? Hold a rattle, pull themselves up, and of course, roll completely over by 6 months. Which first expected fine motor development milestone for an infant begins with what? What do they do first? Remember, fine is fingers, right? What's the first thing they do? And that's that reflex, palmar grasp, right? Grasping mommy's finger. A toddler's parents ask the nurse for suggestions on dealing with temper tantrums. And always remember, it's always a timeout if they're punished, right? And it's 1 minute per year of life. If they're having a temper tantrum, what should you do? Ignore it, as long as it's not going to hurt them. They want the attention. That's why they're doing that. A 2-year-old is having difficulty in activities and sensory sensitivity and only speaks one word responses at 2. How would you assess what's going on with that child? What would you suspect? I mean, 2-year-olds should be speaking sentences. They like sensory stuff, right? But they have sensitivity. This is probably suggestive that a child could be autistic. We do not diagnose autism to age 2 because that's what they need to do the evaluation. So we're going to be using, a checklist, whatever that hospital has, we'll be using that one. The parents are concerned their 8-month-old child's not developing like their older child. So what's normal for 8 months? Sit alone, unsupported. After that, they'll pull themselves from prone up to sitting. That's by 10 months. Multi. A mother of a child suspected of Munchausen syndrome. What should be in the care plan? And what are you worried about if you think a mother is Munchausen syndrome? Remember, Munchausen syndrome is they like the attention of a sick kid, and they're making their kid sick. That mother must be supervised and you monitor any items brought in. They do not need anybody there all the time, only when mom's around or whoever's suspected. What fine motor skills is expected of a 4-year-old child? So we know we start out with the grasp and the pincer and blocks and pulling it out of things. Then we get into things like buttoning shirts, tying shoelaces, again, using the fingers. A child at 4 should be able to button with their fingers their shirt, tie their shoelaces by age 6. A multi. What gross motor skills should a 4-year-old be able to do? Remember, gross, get up, go, go. What should they do? By 4. They should be able to go up their stairs. They also should be able to hop on 1 or 2 feet. Jumping rope, they say, is not till age 6. Okay. And tying shoelaces is a fine motor skill. The RN developmental screening on a 10-month-old should expect which fine motor skills from this infant? So fingers, fine motor at 10 months. We go from palmar grasp. We go into what? Remember, 11 months is the container, putting things in and out. And then by 12 months, it's the block. So grasp the rattle and use a pincer grasp. Frequent developmental assessments are important. Why? Why do we need to know if they're turning over, lifting their head up, walking, crawling? So when we are not meeting the needs, we're not where we should be, we're going to have to institute early intervention and catch them up. So we know if they're delayed, and if they're delayed, we're going to get them that early intervention. Multi. An infant searches for her toy that's not in sight. What is that called? So we know it's object permanence because they get self-exploration and it makes them remember. That's memory development. The natural physical developmental sequence that most children follow is what? It's all gross motor, physical. Physical, gross motor. What do they do? Lift their head up. First thing they do. Very good. A multi, which would alert the nurse to hold the digoxin on an infant she's caring for. You need to know at this age digoxin, just like adults. What do we check for with adults? I think the one thing I'm trying to describe in this question is you need to understand what are the vital signs normal on an infant, what would be abnormal. A heart rate of 90 is too low. So infants at birth, 140 to 160, maybe at 1 year, 100 to 120. 90 is low. Potassium level, dig level, both of those are too low, too high, has nothing to do with pulses, nothing. In general, an infant should triple their birth weight when? And that's at 1 year, 12 months. When an infant toes spread, when the soles of the feet are stroked. Woof.
Dumbisky.
Now, one of the things with infants and these reflexes, they usually go away about 9 months. Rooting is when they want to eat, their face will go towards it. Startle is also called moro, when they are sudden jarred, sudden noise, and their hands and their feet comes up. And grasping, we know about the palmar grasp. How can you prevent otitis media in infants? I did mention this. It's the smoke. Smoke does increase the incidence of otitis media in infants. When entering into an infant's room, when the door slams shut and the infant jerks and starts to cry, what is this reflex? And that's moro or startle. Very good. A 4-year-old is reluctant to take medications. That's not uncommon. What intervention should the nurse take? How many times do I have a 4-year-old that's like, yeah, I don't think so. And the parents can't make them take it either. What the book says is to use a straightforward approach. And what does that mean? Do you want a pill? Do you want a liquid? Do you want it in a spoon? Do you want it in a cup? Right? These give them a choice of how to take it and have them take it. You like the orange one, you like the red one. These are things straightforward. It can help, not all the time, for real. Which intervention helps a hospitalized toddler feels a sense of control? When does a toddler feel better? And that's following the routine, right? What do they eat? Try to keep, if you can. Also, bedtime, bath time, nap time, try to keep their schedule. It does help. A 3-month-old infant does not sleep through the night. What finding is most significant? Why aren't they sleeping? At 3 months, they should be able to sleep at least 6 hours at night. Should be. This is the diaper rash, right? One of the things that you would inspect and then trying to get that cleared up as soon as possible. An RN is testing a 2.5-year-old toddler. What findings should you report to the provider? Which one of these is not right is what it's asking. The head circumference is bigger than their chest. And if it is, they need to find out why. Could be hydrocephalus tumor. Something's going on. That's not right. A multi. What are risk factors for SIDS? So males are more. Any sort of upper respiratory, put mucus, and then smoking. Breastfeeding decreases the risk for SIDS. What does the rooting reflex enable the infant to do? And again, that's stroking the cheek. And that's when they're going to breast or bottle feed. That's how you tell the parents to get them into the mood. Multi. A child has been admitted with profuse diarrhea for 2 days. What would you expect? Now, one of the HESIs that I saw had 4 acid-base questions. So when you look at diarrhea, what is diarrhea? It's all the digestive enzymes. It's all alkaline is being squirted out. Diarrhea. What is left? Just like when you vomit, you're getting rid of stomach acid. What is left? I'm trying to get you in that how to remember. Metabolic acidosis, and of course, you always get rid of potassium. Normal language skills for a 3-year-old. And that's 4 words by a 3-year-old. 1 to 2 is your 1-year-olds. An infant's unable to take the breast or bottle for feedings. What's important to remember? Remember growth and development. What does an infant need if they can't eat? And then I'll go into how do infants soothe themselves when they're stressed out? Give them a pacifier. Okay, it is recommended today. And I've seen it go all different ways in my career, but it is recommended. Last question. What does an infant start to do at 3 months? And we know that's when they start lifting their head up. Very good. Catherine, number 3. Good job. Number 2, Daisha. Number 1, ding. Kate. Good job, Kate. Number 4, Jen and Kenyon. So thank you very much for being patient today. A lot of information. And I know that. Anybody who wants to meet with me before the exam, I'm always available, to help you with it. I'll be posting this later on tonight. In fact, I have a class right after this. So I'll be posting it by about 9 o'clock tonight, all the information, including your codes. Any questions by anybody? You only have a discussion question due this week, and most of you have already done the initial. So thank you.
Thank you.
Thanks,
Thank you.
guys.
Thank you.
You're welcome.